The following program is a special presentation of the Big Ten Network, produced in association with the University of Wisconsin.
The H1N1 flu virus is upon us. It's the focus of intense media attention and the medical community nationwide. We'll take a look at the facts and myths surrounding the H1N1 flu, next, during office hours. I'm Ken Goldstein, political science professor at the University of Wisconsin-Madison. Traditionally, flu season begins in the country as the weather turns colder and the leaves fall from the trees. But this year, we've seen a strain of the flu that hasn't taken any time off from its infectious journey through the populace. H1N1, as the strain has been identified, is also unusual in that it attacks school-age children more harshly than other age groups. What do we know about the virus? What can we expect to see in the coming months? And what can we do to lessen our chances of infection? Joining me to discuss this are two experts from the University of Wisconsin who have been on the front lines of the research and clinical battle against H1N1. Chris Olsen is the Associate Dean for Academic Affairs at UW School of Veterinary Medicine, where he leads research in virology and the transmission of influenza. Dr. Sarah Van Orman is the Executive Director of University Health Services at UW-Madison. She was also previously the Medical Director at the University of Chicago Student Care Center. Sarah, Chris, thanks very much for joining us on Office Hours. Chris, I really want to give you, I guess, a Flu 101 question, which is, can you give our viewers just the basics of what is an influenza? What is a flu? How does it differ from the other sorts of ailments we might get during a typical winter season?
Sure. Well, flu is a virus, so first and foremost we have to think about the fact that viruses and bacteria are different. We treat viruses and bacterial infections differently. Influenza is a particular kind of virus, and there are lots of different forms of influenza virus that exist.
Okay. And this particular strain that we're seeing now, we actually have a student, we went out and asked students some questions, and I think she has the question which I think is the basic question, so let's go to that question.
What's the difference between seasonal flu and H1N1?
What's the difference between how it presents to you when you see students and how it might be on the science side? But let me ask you that first, Sarah.
Well, I think there's really two things that we need to talk about when we talk about the difference between H1N1 and seasonal flu. First is its clinical presentation, and that is when someone is infected with H1N1, what happens, what do they feel? And in many ways, the sort of clinical presentation for H1N1 is similar to seasonal flu. It causes a very characteristic illness, sudden onset, fever, body aches, cough, sore throat. We are seeing some minor differences between seasonal flu and H1N1, so we've seen a little bit more sort of stomach symptoms, diarrhea, and those sorts of things with H1N1 than seasonal, but for the most part, it's a very similar illness. The reason why H1N1 is different than seasonal flu, however, is that it is what we call a novel influenza virus. So what that means is that the number of people affected and how quickly it spreads and the susceptibility of the population is much, much, much greater than we would see with seasonal flu. Everybody is susceptible to H1N1.
Say a little more about that. Why it spreads so much quicker, so much easier than a regular seasonal flu?
I think that's one of the key things that we need to think about when we're thinking about pandemic influenza. So I hear a lot of people say to me, well, this is causing a relatively mild illness. It's no worse than seasonal flu. And I think that's true for many of the people who are getting it. There are some differences. But when you have a pandemic influenza, it means that your entire population is susceptible. So in a normal seasonal flu season, we might see 5–10% of our population infected because most people have some underlying either complete or partial immunity to the strains of virus that are circulating. When you have a pandemic with influenza, typically it means you have a novel virus. Nobody has any immunity to it. So you can see large numbers of people affected, this is where you hear the number 40, 50, 60% of the population might get sick in a very short period of time.
Chris, let me turn to you. So Sarah said it was a novel virus, meaning
Sure.
we don't have, people haven't faced it before, so we haven't built up any immunities to it. But we're seeing this interesting pattern where older folks don't seem to be getting it.
Right.
And there's a couple different hypotheses. So one hypothesis is they're not out and about as much, so they're not likely to pick it up. But the other one is maybe it's not so novel to them. Do you want to speak to that?
Correct. You know, H1N1 is just a way of naming viruses, and so there is a normal seasonal H1N1 virus as well. This one is different because of its origins, and why certain people are getting infected and not, we certainly don't completely understand. One theory is, as you said, younger people are out and about more. The other theory is maybe the H1N1 viruses that have been circulating in human beings for many, many years, still H1N1, but different from this one, but maybe there's a little bit of cross protection, and we're beginning to see some very early data that suggests that in fact that might be the case.
So if I went over to your lab, and excuse me for my poorly I did in biology in high school, and we were to look in a microscope and you were to show me a seasonal flu and an H1N1 flu, what would the differences be? Would those be significant?
No, visually they would not be significant. It really gets down to the genetics of the virus, and these seasonal H1N1 and pandemic H1N1 are genetically different. Even though they have that same H1N1 designation, they're genetically different in where they came from, in their origins, and in terms of their structures now. But visually, they look very similar.
And again, is this H1N1 just dangerous because it's novel? Or is it, I'm trying to think how to phrase the question. If we were to take people who'd never been exposed to the normal seasonal flu and the H1N1, would it be the same implications?
Yes, I think that is true. There is, though, and I think that there's some things we don't know yet. We are seeing that if we look at a typical seasonal flu season, the people that have the more severe disease, meaning hospitalizations, really severe things, tends to be elderly people, tends to be people who are older. That isn't the case with this, that we are seeing very small numbers, but what we would call sort of excess numbers of young, healthy people who are getting severe disease.
Let me be rude and interrupt you here for a second. We're going to go to break, and when we continue, I want to follow up on that, because you have certainly seen a lot of young people here at the University of Wisconsin. So please stay with us on Office Hours, and we will continue our discussion of H1N1.
This program is a production of the University of Wisconsin-Madison. If you have comments about this broadcast, please email them to programming@uc.wisc.edu.
For more than 100 years, the University of Wisconsin has been inspired by the Wisconsin idea,
which says the good work of the university extends to the boundaries of the state and beyond.
So the UW works hard to help build Wisconsin's economy.
Educate people of all ages.
Advance health and medicine.
And enhance the quality of life for all of us.
Hit it!
The University of Wisconsin-Madison. Forward thinking.
Welcome back to Office Hours, where we're discussing the H1N1 influenza. Sarah, interrupted you at the end of the first segment. Tell us a little bit more about what you're seeing here.
Yeah, so we were talking a little bit about the severity of the virus and how it could affect the community. So I think there's two things to think about with the virus. One is that we are seeing that severe cases of the disease in young people, healthy people. We're also seeing that in young people who have underlying health conditions. So even though those numbers are very small, there's a very real concern that if large numbers of young, healthy people or young people with underlying conditions get this virus, a certain small percentage of those are going to have very serious complications. So I think that's the first thing to understand about it. The second thing is that even with relatively mild disease, if you have a disease that where 40 or 50% of your population gets it, if you consider the potential impact that that has on our healthcare system, on our schools, on our businesses, on our safety, on our infrastructure, that's the other really important thing I think we need to think about when we consider a virus that has the potential to affect so much of our population.
In our lifetime, the last 20, 30, 40, 45 years, have we seen a disease where you've had 30, 40, 50% absences? So we haven't seen that. You know, Chris, the way this is described often among people and in the media as swine flu.
Right.
Has nothing to do with swine, right?
Well, so it does and it doesn't. Genetically, if you go back and look sort of over the evolution of this virus, yes, there are signatures that are similar to influenza viruses from pigs. But that emergence from swine influenza viruses, the data now suggests, may go back as long as 10 years. And so from the time that this virus was first recognized in Southern California in early April, this is really a human virus. This is a virus that's very well adapted already to people, and it's being transmitted from person to person. So transmission patterns now have nothing to do with pigs. They have nothing to do with pork or any kind of food safety issues.
So let's talk, and let me turn to Sarah to talk about how you get it. But let me just reiterate that point again with you. I don't personally eat pork or bacon,
right.
But if one were to do that, that's not going to give you this. That's not going to give you the H1N1.
That's right. This virus is strictly in the respiratory tract of the pig. It's not in the meat. So this is not a food issue whatsoever.
How do you get it, though?
Yeah, it is a human issue, though. You know, one of the challenges with influenza viruses is they're really easy to spread from person to person, and there's a couple of ways that happens. It can certainly be sort of aerosolized. So if I'm ill, I cough, I sneeze, and when I do that, small little particles come out of me, and that can spread directly to someone who's very close to me in face-to-face contact. The other probably more common way that it spreads is I cough, I cough or sneeze into my hand or onto the table. I leave, you come in, you meet with the next person, you put your hand on the table, you pick up those viral particles, and then you touch your mouth or your eyes or your nose, and then you transmit it that way. When you hear all these messages or people talking about the hand washing, cover your cough, that's why those are such very important messages. Is right now the only protection we have against this virus for most people until vaccine becomes more widely available is people hand washing, covering their coughs, and staying home when they're sick so they don't spread it to other people.
Chris, what exactly is the hand washing do? Because I have a number of people say to me, well, ask your two guests, why should we be washing with antibacterial soap if it's a virus?
Right. And so the reality is you don't need antibacterial soap.
Okay.
It's the soap.
It's the soap.
Right. Influenza virus, the structure of it is destroyed by soap. And so simple soap and water will very quickly inactivate this virus. Likewise, the alcohol hand sanitizers also help. The alcohol simply denatures the virus and helps to reduce its infectivity.
And so it's literally the disease comes out of my body, goes on a table, you touch it, and then speak a little bit more, because it's eyes, nose, mouth.
It's what we call mucous membranes, and so for people, that's really those surfaces that are kind of like the inside of our mouth, the inside of our nose, the lining of our eyes. Those are all places where a virus can be transmitted, and so typically it's people touching their face and with their hands after potentially picking it up on another surface.
When we come back on Office Hours, we're going to discuss a new vaccine for H1N1 and hear from our experts about whether you should get that vaccine. Please stay with us. Welcome back to Office Hours, where we're discussing H1N1. There is now an H1N1 vaccine available that is making its way into our schools and communities. And we went out and asked University of Wisconsin students when the vaccine's available here, whether they're going to go out and get it. Let's hear from a couple University of Wisconsin students.
I'm not planning on getting vaccinated just because in general, I don't get flu vaccines. Because I'm not too concerned about getting the flu. I guess I wash my hands frequently, and then I figure if I'm going to get sick, I'll get sick.
Well, because I would like to take it, but just maybe until later, because I'm kind of like busy with my midterms right now. But after I'm done, probably want to get it. Because, you know, it's like lots of people get sick, like more and more people just like keep coughing in the class, kind of like worry about that. I don't want to to delay my education because of the H1N1 flu. So that's why pretty much I want to go for it.
No, because it's just like the flu and you'll get over it, and I mean, everyone's getting it. There's already been some people in my house that think they've gotten it, so I don't really mind.
Yeah, I plan on it. Actually, 2 to 3 weeks ago, I did the seasonal vaccination, and I'm going to get it because I'm a health science major. I know the vaccines can help. I think more people should get it.
No, because I usually just don't get vaccinated for flu, and it's just the same as the seasonal flu, so basically.
I've thought about it, and I think that I will get vaccinated if the opportunity is there. And I have based my decision just on the fact that we're in such close contact here at the university that it's a very good chance that it'll get spread around.
So Chris, we have some of our students are going to get it immediately, some are going to get it when they have a chance, and some aren't going to get the vaccine, and you heard people articulate some thoughts on that. You also hear that some people say that there was such a rush with this vaccine that they're not sure it's actually safe. Others, like some of our students, said, you know, it's not really a big deal. It's like the flu, and I'll get the flu. And others just don't like getting vaccines. Could you speak to some of those concerns, especially this concern that there was a rush to market with this particular vaccine?
Yeah, and I think it's important that we talk about that, because I know I've heard that same perception frequently out in the public. The reality is, every year when the new seasonal flu vaccines are created, it takes about 5 months from the point that you pick the strain of virus that you're going to use to the point that you have vaccine being shipped to providers. Well, CDC and WHO began picking the strains for the pandemic vaccine right around the beginning of May, and it's now mid-October. It's 5.5 months. We are right on track. The exact same process has taken place in terms of production and safety testing and so on with the pandemic vaccine as occurs every year with the seasonal vaccine. So there is no rush.
So Sarah, when you hear some of our students saying that they're not going to get the vaccine, and you're essentially our chief medical officer here on campus, speak to them.
Well, the first thing I would say to people is that I think it's very important that every student really take some time, read about the vaccine, and strongly, strongly consider being vaccinated. I think when we look at what happened on our campus during the first 2 weeks of September, within a very, very short period of time, we had large numbers of students affected. Their classes were interrupted. They left campus. We had a serious situation trying to manage all of those people coming into the health service. The potential for this really disrupting their academic progress. I think from that standpoint, they need to consider getting the vaccine. We also know that many of the students who've had the flu, the vast majority have gotten better, but many of them have had very serious illnesses. They've had complications from it. They've developed pneumonia. So even a young, healthy person getting influenza can have an illness that lasts a couple of weeks. So to protect themselves and to protect the campus community, people really need to consider receiving the vaccine.
And you mentioned that we got hit the first week or two at University of Wisconsin pretty quickly. So when we come back on Office Hours in our last segment, we're going to talk with some of the lessons learned from the early influenza outbreak here at the University of Wisconsin-Madison. Please stay with us.
This program is a production of the University of Wisconsin-Madison. If you have comments about this broadcast, please email them to programming@uc.wisc.edu.
Welcome back to Office Hours, where we're talking about H1N1. Chris, one other thing about the H1N1 vaccine. There's also a high probability it might be more effective towards H1N1 than the regular seasonal flu vaccine is against the seasonal flu. Tell us why that might be the case.
Sure. Well, every year when decisions are made about creating the next year's seasonal flu vaccine, it's a bit of an educated guess, much more educated now than it was 30 years ago, but we don't really know specifically which strain is going to dominate the next year, so you try to make your best estimate. We have a huge advantage this time around with the pandemic vaccine because we know which strain we have to protect against. And so we can have an almost perfect match between the circulating pandemic strain and the vaccine. And so the better that match is, the more efficacious the vaccine is going to be, the better protection it's going to offer.
So there was no vaccine when school started this fall at the University of Wisconsin, and we were one of the campuses to get hit first and hardest. Is that correct?
Yeah, we had a very significant outbreak right when classes started. It was really that first or second day of classes where we saw a tremendous number of students presenting to the health service with symptoms consistent with H1N1, and of those students, they overwhelmingly tested positive for the H1N1 virus. Since that time, we've seen a drop-off each week in the number of cases, but I would stress that we're still seeing a number of influenza-like illness cases that's above what we see during a typical seasonal flu season. Madison. So even though it's lower than it was, we still are in the middle of an H1N1 outbreak here on campus.
So why did the Badgers get hit hard early?
You know, that's a great question. Certainly some of it has to do with the nature of our campus, that we have a very kind of closed campus community. So even though not everyone lives on campus, people kind of come to Madison and they gather pretty tightly in this community versus a campus that's more of a commuter school. There were a number of outbreaks, though, on a number of large campuses, many with similar demographics to Madison, and they all happen, interestingly, on exactly the same day in the semester. So if we look at what happened, it's almost an identical pattern on all the campuses that were affected.
So when you get a chance to catch your breath, there could be an interesting paper coming out of this on the timing.
Oh yeah, probably.
Now, if I'm a colleague of yours at another university, and I call you up and I say, Sarah, 1 minute, lessons learned, it's just starting to hit my campus, what should I do?
Well, I think a lot of it's about planning and finding partners. We had a very coordinated across the campus communication effort using all of our campus partners, police, communications, academic departments, and that was very important to be able to quickly get out the appropriate public health messages about what people should do, what should they not do, what should they worry about, and then being prepared to respond. So we had a really amazing, I think, campus response on faculty, staff, and students' part, and I think that's the critical thing.
Because of work done in June, July, and August was why September.
Mm-hmm.
Chris, you know, about 30 seconds left. You know, in your lab, what's the exciting thing going on in terms of influenza research? Is this something that we can ever be able to figure out what that code is early enough to create vaccines?
Well, we certainly hope so, and there's lots of different fronts being looked at in terms of combating influenza. The thing that we're most interested in is really trying to understand that species specificity and what does it take for a virus to move from one host to another. And so we have some interesting things going on right now, some great collaborations with colleagues in London, and so we're excited what the next few years might bring.
Super, and we will have you back on Office Hours to talk about that.
Look forward
Sarah,
to it.
Chris, thanks so much for having us. Thanks to all of you for joining us in Office Hours. Please come with us next time.
The preceding program was produced by the University of Wisconsin in association with the Big Ten Network.